First, big thank you to Nancy for such a kind introduction. Nancy was a progressive back when, before they were progressive, back when we were called liberals. And she's always been a lesson to me, and she was a moral force in the General Assembly. So I'm thrilled that she gave me that kind of introduction. And thank you to my fellow electeds who are here. I want to also recognize Tony Silva, who I worked with when he was Cumberland Police Chief, Attorney General and U.S. Attorney. Since then, he's gone to work for Danny McKee. So he's a the battles we have coming up in Washington are really serious ones. And we have, among other things, a chance to retake the Senate. 6 or 7 months ago, I don't think I could have said that with a straight face. But as the American people have seen the behavior of the Trump administration, there's been a very, very strong shift. And the result is that we are actually looking at the possibility of picking up seats. Who knew? Who knew that we could elect a Democrat to the United States Senate from Alabama? The quality of his opponent had a little something to do with that. So that's not to say that it's going to be easy everywhere, but you also saw the huge sweep in Virginia, just across the board. And so there's, I think, a real possibility. So we're trying to make sure that we get as organized as possible here in Rhode Island, not only to keep me in office and keep that seat in Democratic hands, but also to help support David and Jim, and also to do things like reach out from Rhode Island to other races that matter. So we had people making phone calls down in Alabama to help Doug Jones win that race. And the more that we can engage you in that effort, the more I'd appreciate it. Because I think we will make a difference, not just in Rhode Island, but in other places as well. I'll just check off some of the issues that I think are really key right now that we need to work really hard on. One is to protect and improve our healthcare system. The repeated attacks on the Affordable Care Bill, I think, were completely unjustified. And the fact that they didn't have a legitimate alternative convinced me that most of those attacks were just for purpose of doing destruction. They didn't like that President Obama had done this, and they had revved up a whole lot of people, and it was a terrible thing, and they needed to come through even against their better judgment. And I am sure that there are Republican colleagues who are breathing a huge sigh of relief that repeal and replace failed, because the mess that they would have replaced it with would have come home to hurt them and haunt them. So we need to keep defending that, because that's not over, and there are ways we can improve our healthcare system even more.
Like Bernie Sanders' Medicare for All?
Which I'm a co-sponsor of, and we need to talk about that.
But even with
good progress.
The elderly ended up paying, you know, a lot of money, that, you know what I'm saying, depending on what they made. If you talk to the, like I talked to a lot of elderly, when the Obamacare was in, the problem was charging, you know, they were paying like $500 a month for, you know.
Obamacare never touched Medicare, so if you were elderly, you would have been on Medicare or depending on your Medicaid, so you would have been fine.
Right, but what I'm saying is, don't you think that's an outrageous price? I mean, if we're gonna do it across the board, don't we consider the elderly across the board?
Well, we do, and that's why Medicare is there. And Medicare was not changed by Obamacare in any way. Now, sometimes
then they should be looked at to see how we could help the elderly.
The best thing to do to help the elderly on Medicare is to fix the adjustment to Medicare that happens every year.
Yeah.
Because it doesn't go up fast enough to meet the increase in cost that elderly people pay. And I'm a co-sponsor of the bill that would do that.
Yeah.
Too often you see the Medicare payment goes up a little bit, Social Security payment goes up a little bit, and it gets balanced out, so you end up with no value as a result.
And another
well, let me just finish two other points, then we'll open up to everybody. The other issue that I think is really important that is looming towards us is the attack that I think is coming on Medicare and Social Security. And a lot of us have suspected for a long time that when the Republicans try to run up the deficit, their plan is to use that as an argument to go after Medicare and Social Security.
And I thought
And we suspected that for a long time. Recently, the Republican leadership has been saying that. So it's no longer suspicion. Now, it's clearly the plan that they run up a tax bill that adds $1.5 trillion to the deficit, and then they say, oh my gosh, we have a $1.5 trillion addition to the deficit, we have to do something about it, let's look at what they call entitlements. So Bernie and Sherrod Brown and I founded the Defend Social Security Caucus, and we are all in to make sure that we defend Social Security and Medicare, to the point where we even fought the Obama administration back when they tried to lower the increase in Social Security payments every year, their so-called chained CPI scheme. So we don't just lock up with whoever's in the White House, we do what's necessary to protect Social Security no matter who's in the White House. And the last thing I'll mention is the issue of our coastline. We have to protect and defend Rhode Island's coastline. Our own university, the University of Rhode Island, our own Coastal Resources Management Council are predicting that we're going to lose 40 square miles about of Rhode Island to the ocean as the sea levels rise. They're already building dikes around the sewage treatment facility in Narragansett. They've already had to build dikes around the sewage treatment facility in Warwick. They're already making plans to move entirely the sewage treatment facility in Warren. And all of the maps are having to be redone to look at what's coming. And the map that CRNC shows of what's coming will change the map of Rhode Island. And I do not want to be a senator on watch. I do not want to be a senator on watch when the map of Rhode Island changed because we failed to act. So Block Island becomes Block Islands, breaks into two. Jamestown Island breaks into three. Warwick Neck becomes Warwick Neck Island. Warren and Bristol become islands and get new islands of their own. Barrington goes considerably underwater. There's a great salt pond that happens in the middle of Barrington. So these are things that our own regulators and our own university are telling us. To me, that's something that's worth listening to. So fight to make sure that we protect health care for everybody. Fight to make sure that Social Security and Medicare don't get attacked. Fight to protect our coastlines. I think those are fights worth having. And those are the fights that I am determined to continue and determined to win. I'll close with one observation. When bipartisanship works, I'm all in. The biggest piece of legislation that Congress has passed on the opioid epidemic was something called the Comprehensive Addiction and Recovery Act. Rob Portman, a Republican, and I spent 3 years working that legislation and getting it ready for the floor and getting all the different groups lined up around it, from law enforcement to the doctors to the treatment community, so that when we got it to the floor, no matter what the partisanship was on the floor, that bill had to pass. And we called it up, we made it pass, it did pass. It is in law right now. The President Obama signed it into law, and behind it came $1 billion that we insisted on in new funding for opioid treatment. Do we need to do a lot more? Yes. 42,000 people died last year. 6 died in just 3 months in Burrillville alone 3 years ago. Imagine how small Burrillville is. There are about 30 people in the whole police department. 6 times in 3 months. You'll have plenty of time, I promise you.
43,000.
6 times in 3 months.
That's almost the population of Woonsocket.
Go out to the rescue call. The community had to come to the wake. The funeral home had to handle the young person's remains. That needs our attention, and that was something we did on bipartisan